Hello friends and colleagues. Myself Dr. Ajay Kumar Tiwari from Maharshi Arvind College of Pharmacy here to present the topic drug distribution process in pharmacokinetics. The learning objectives of the present topic is upon completion of course, students shall be able to understand the basic concept of drug distribution process in pharmacokinetics, understand the significance of drug distribution process, explain basic steps involved in the process. Along with that, student will also be able to describe important physico-chemical properties of drug affecting process of distribution. Now comes to drug distribution. The different contents here I am going to present are introduction, the significance of drug distribution process, the steps involved in distribution, various physical and chemical properties of drug affecting distribution process, and finally references. Here the drug distribution is a part of disposition process of pharmacokinetic process in the body. It is not uniform throughout the body, and the process explicit at different rate and extends between plasma and body tissues. It is a reversible process oftenly. Along with that, we can say distribution of drug is a passive process, and it is because of the concentration gradient, that is a force between the process of distribution between blood and tissues. Along with that, distribution is proceed with diffusion of free drug only until equilibrium. Now comes to how significant the drug distribution process is, as the concentration of drug at site of action determines its pharmacological action. And here we can say the distribution plays a very important role in different steps, or we can say pharmacodynamic properties like onset of action of a drug, intensity of action, and duration of action of a drug in body. Now comes to the different steps involved in distribution process. Majorly we can say two basic steps are there which are involved in the process of distribution. Step 1 is permeation of free drug through capillary wall and entry into extracellular fluid. The another step is permeation of drug from extracellular fluid to intracellular fluid through biomembrane of tissues. Now comes to reflection spot. Do you think the process of drug distribution can be affected by some physical and chemical properties of drug itself? Think of it, pause the video and write your answer in a notebook. Then play the video further. Here we have a number of physical and chemical properties of a drug which definitely affects the distribution process of a drug in our body. Few of the important physicochemical factors of drug that affects penetration of drug through biomembranes are molecular size, ionization constant of a drug, and partition coefficient of a drug. Here, first we'll discuss about molecular size. Molecular size of a drug will definitely have impact of drug absorption, or you can say the distribution from blood compartment to extracellular fluid, and simultaneously from extracellular fluid to intracellular fluid in the cells. Now here we can see the drug along with plasma proteins, which is represented by D and P respectively in blood compartment, moving randomly. Now they both are available for the distribution, or we can say transfer from blood compartment to the extracellular fluid through capillary wall. Here we can see the drug size less than 50 Daltons can pass through the aqueous channels present in the capillary wall, and similarly the same drugs with the molecular size can also cross the cell membrane and pass from extracellular fluid to intracellular fluid, that is known as bulk flow process. Now we have the drugs which have the greater lipophilicity and having the molecular size more than 50 to the extent of 600 Dalton. They cross the biomembranes through passive diffusion process. Here you can see these category of the drugs crosses the capillary wall as well as cell membrane through passive diffusion process. Here now we will talk about the polar or ionized drug which have the size greater than 50 Dalton, can cross the capillary wall through active transport, but in case of transportation through cell membrane they need a carrier, which is represented by the sign of C in the presentation. Here now we may see that the drugs may have the binding with the plasma protein in blood compartment, and because of increase in size of the molecule they will not be able to cross the capillary wall, as well as if the drug binds with the plasma proteins present in extracellular fluid, at that time also the size of drug molecule becomes larger and cannot cross the cell membrane also. Now the another physicochemical property of a drug that is known as degree of ionization. This term represents the pH of drug at which half of a drug is ionized. Here we can see the impact of degree of ionization on the permeation of a drug from biomembrane. Here we have the categories like very weak acidic drugs, stronger acid, very weak bases, and stronger bases along with their examples. Now, for example, very weak acidic drugs like phenytoin represents the state of unionization at all pH of the body. Thus, the permeation of this category of drug is quite rapid to the highest extent. In comparison to that very weak acids, the category of stronger acids will remain ionized at all pH of the environment, we can say of the body, and show the permeation to the extent of very low. Here we have the another category of bases also, which represents the phenomena in a very similar way to that of the acids. These are the examples of influence of pKa, that is degree of ionization, among the drugs with similar partition coefficient but differ in extent of ionization at blood pH. Now, the third physicochemical property, which is quite important, that is partition coefficient of drug, which affects the distribution process. Here we can say the partition coefficient is a property of a drug by which the drug partitions between water and lipid layers. The categories of drug like polar and hydrophilic are less likely to cross cell membrane. In comparison to that, non-polar and lipophilic drugs are more likely to cross cell membrane because of greater lipidic in nature. This partition coefficient, in fact, we can say effective partition coefficient of a drug can be calculated by the given formula, that is fraction unionized, that is for a drug, that is to be multiplied with partition coefficient of unionized fraction of a drug at physiological pH. Here the reference of the material to be acknowledged: the Biopharmaceutics and Pharmacokinetics, a treatise, a book by the author D.M. Brahmankar and Sunil B. Jaiswal. Thanks for your attention. Thank you.